you, Natasha. Today, the province will be unveiling its COVID-19 vaccine strategy with a task force. Premier Ford is insisting that they are prepared to spring into action.
Well, what I can guarantee the people of Ontario, we will be ready. As sure as I'm standing here, we will be ready. We have a phenomenal team.
And this announcement coming the same day that more regions are expected to move into higher color-coded zones of pandemic restrictions. But who and what's it going to look like? Joining me now is Ontario's Chief Medical Officer of Health, Dr. David Williams. Good morning to you.
Good morning, Melanie.
Thank you so much for joining. I was watching your news conference yesterday, and you did mention that some regions will be changing today. Can you elaborate at all, specifically with York Region, with a lot of speculation that they'll be joining Toronto and Peel in lockdown?
Right now, we're expecting to get a decision today from the Cabinet on our recommendations. We are moving some up from lower colored zones into higher color, just because we're getting a lot more activity in the outer areas. Unfortunately, they're seeing much more case numbers going up in that. So we are monitoring all the ones, especially the ones in our red zones in there. And of course, we keep an eye on R2 and lockdown in that. So by noon hour, we should have, or at the 1 o'clock presser, we should have the announcement to the changes specifically for all the parts of Ontario.
Dr. Williams, what is the threshold for, let's say, York Region to potentially move into that gray lockdown zone? What is being monitored right now for it to change?
So the lockdown zone doesn't have an actual number that jumps over. There's a combination of different factors, and that's why we look at the analysis of what's trending over the last 2 to 3 or 4 weeks, cases per 100,000. We look at positivity rates, see if they're accelerating and changing. And all those things considered, including the hospital services, how are they doing? Are they having struggles? And the health unit, is it having struggles maintaining contact management, et cetera? And then we talk to the medical officer of health and see what steps do you have in place? How do you assess it? Are things under control? Are things steady in there? But we'll talk to some health units and say it's going up rapidly. We're starting to lose some capacity on case contact management, or we have issues. Some of the hospitals are having trouble. So it's a combination of different factors in there, all weighing in to make a decision with lockdown. It's not an easy decision. It's a major one, and we don't just do it on 1 or 2 metrics alone.
We are looking at 2 weeks since it was announced that Toronto and Peel would move into lockdown. How are we right now? You did mention hospitalizations, in a bit of trouble looking at the numbers with the intensive care units in both regions. A lot of people sounding the alarm, saying this is putting elective surgeries at jeopardy. Things are being pushed down. Do you potentially see more further restrictions for Toronto and Peel? Where are we when it comes to progress?
Well, since we did the lockdown, I can say that the cases per 100,000 for each of the areas, Peel and Toronto, have come down. Their positivity rate and their testing has come down. So these are all good steps. We've had some modelers saying it is having impact in that. We are plateauing continually around those numbers instead of, say, after a week or two where we were supposed to be doubling or increasing by about doubling every 10 to 12 days. We haven't seen that, so those are good signs. Yet the numbers haven't plummeted considerably, but they're staying and coming down in the right direction. Still more work to be done, but it's looking good in that way. But as we used to use the word last week, we call it precarious. That means everybody really has to stay focused. The hospital ones, there are some facilities that are having some more pressure than others. The whole system itself has the capacity to move people around and deal with that. But that's also precarious. We want to make sure we try and keep those numbers down and to see if we can back off. Because the cases, as you get cases, after 2 or 3 weeks, we have 10 days, 14 days, you start getting admissions. And then later after that, you get ICU patients. And then sometimes, unfortunately, later on, you'll start to see some deaths. So it's always a bit of a lag time between the case numbers and the hospital impacts.
Dr. Williams, do you have an update on case numbers for today, new case numbers and deaths?
Our case numbers for today, we've come down a bit from yesterday. We're down to 1,780. and our deaths has, unfortunately, we still have 25 reported from various settings, one under the age of 70, but the others tend to be the elderly and the ones with comorbidity, and some, of course, unfortunately, still in our long-term care facilities. So it's across the board, but still a significant number. As you say, this is lagging behind the cases, and we're seeing that. And fortunately, it's not as high as some other days, but still it's significant.
Indeed, when we look at the rolling average, I want to get your take when it comes to the COVID task force. Obviously, all talk around a potential or a vaccine coming to us and what that plan is going to look like. Do you have any further insight as to who might be sitting on that task force or who you would recommend to sit on that task force?
Well, yeah, a task force always has a variety of different qualifications and individuals to give guidance and advice in that direction. That's what we've used a lot of our tables for, just because we want to make sure that we've considered all facets in there. And so I think it'll be a good eclectic group combined with our experts in the province that have done this many times. One of the advantages here in Ontario is that every year, we have done universal influenza immunization program where we have always done a large percentage and number of cases. So this year alone, we've rolled out already between October and now 5.7 million doses of influenza. And that's a record for us, but that's out to a variety of different areas and sectors. So we're used to this vaccine distribution, mobilization. We have equipped a lot of different people to do immunizations. So I think we're in a good position to ramp this up even further, and getting the advice and direction of our task force and others, I think we'll be well equipped to hit the ground running when we get the vaccine in place at different times in different ways, and to cover the required areas in a very timely, sequential basis.
Dr. Williams, before you go, I do know you have some other meetings to attend to, but I want to get your take on education. And very alarming seeing Thorncliffe Park Public School being closed with a number of asymptomatic positive tests coming back. Will you be recommending that it be expanded, the asymptomatic testing, more sites like this popping up across various hotspots like Toronto?
Well, what we've been doing not only in Toronto, but in other areas in Ottawa included, that the local health unit, when you have more and more cases in the community, unfortunately, they'll start having more and more children and sometimes staff coming to the school already positive or incubating. So they may be asymptomatic, but incubating at that time. So the higher the percent positivity around the school, because the school is part of the community, the more you'll have coming in. What they have been doing when they find some cases, especially if they get a cluster right at the start, many will often choose to test the whole school first, to test and then close it until they get all the cases assessed, and to ascertain if there is an outbreak, if there is ongoing transmission in the school. And sometimes even after 4 or 5 or 6 days or a weekend, they can open it back up again because they realize that the cases are basically from the community coming in. There's been no transmission in the school. There may be a classroom they may want to keep cohorted. So generally, that's been our approach, and we're working with Toronto and with Peel to say, if you want to undertake that, we can have a team come in and assess a school whenever you want us to do that, and to get everyone tested to ascertain if there's symptomatic or asymptomatic people, especially children. The younger ones often don't show a lot of symptoms, and as well, they're not high transmitters per se, but one would like to make sure you've assessed that properly, and that everybody is persuaded, including the parents and staff, that things are under control and you're managing it in a timely fashion, and they're kept informed of the progress of the whole investigation.
A lot to monitor here, indeed. Dr. David Williams, we appreciate you taking the time today to answer these questions. Thank you.
Thank you, Melanie. Have a good day.
Thank you to you as well. And we will be staying tuned for that 1 p.m. announcement when it comes to various regions that may be moving in that color scale.